If you're a lady with pelvic pain, here are the things I recommend you start with. So, if your pain is on the outside and you think there's a dermatological piece, what are you washing yourself with? Bath and Body Works is great, but it's not. It's irritating to your pelvic floor. Your pelvic floor does not need soap, just water. And your hands, not a loofah, not a washcloth, not a Norwex cloth, like just hands and water, no douching. If it feels dry and you're perimenopausal, menopausal, postmenopausal, there are suppositories, supplements, and vaginal moisturizers. Yes, I said vaginal moisturizers for those women. We know in research, if you are 2 to 3 years postmenopausal, you need to care about this hydration of the vag because the dryness will lead to discomfort. If your pain is internally and it is deep, do you feel like your insides are falling out? Do you feel a heaviness? If so, please go see your OBGYN and get checked out for pelvic organ prolapse, because I don't like that you're having that heavy falling out feeling, okay? But if you feel like there are it's a deep pain and it's tight and you've seen your OBGYN and they don't see anything, it's either muscles or nerves. So then I want to ask you to get a referral to see a women's health physical therapist. Yes, you can ask your doctor to write you a referral to a women's health physical therapist, and all they have to write on that prescription is pelvic floor evaluation. That's it. Now in Ohio, we have direct access, but not everybody has direct access. So then if you are having deep pelvic pain, you think it is muscular, I want to ask you to think about your hips. Do you have tight hips? Do you think you could do a cross leg stretch? Do you think you could do a butterfly stretch? So if your hips are tight, we need to stretch it. Now there are some of my patients that have hypermobility, and this is how some of my patients have EDS, which is a connective tissue disorder. And these patients, we don't stretch always their hips because sometimes their hips feel like they're falling out of socket. Now, if you have leaking and that's your only symptom, you could have a pelvic floor exercise routine that you are squeezing your pelvic floor and doing Kegels. But if you have pelvic pain, you might not have Kegels as an answer because you could have what is called a hypertonic pelvic floor. If you have a hypertonic pelvic floor, we look and see if your hips are tight. So stretch your hips if they are. If your pelvic floor is tight, we're not going to strengthen your pelvic floor, but we could work on stretching your low back. We could work on stretching you internally. Now, if you were to use your imagination, how would we stretch you internally? Yes, there's the dreaded dilators. A physical therapist can do it manually, so can your partner, but you could also work on muscle relaxers, Ativan, CBD, and other things to naturally relax you like magnesium.